Predictive analytics can support population health management, financial success, and better outcomes across the value-based care continuum. Instead of simply presenting information about past events to a user, predictive analytics estimate the likelihood of a future outcome based on patterns in the historical data. This allows clinicians, financial experts, and administrative staff to receive alerts about potential events before they happen, and therefore make more informed choices about how to proceed with a decision. In this video we will see 10 high-value use cases for predictive analytics in healthcare briefly. Risk scoring for chronic diseases and population health. Prediction and prevention go hand in hand, perhaps nowhere more closely than in the world of population health management. Organizations that can identify individuals with elevated risks of developing chronic conditions as early in the disease's progression as possible have the best chance of helping patients avoid long-term health problems that are costly and difficult to treat. Avoiding 30-day hospital readmissions. Hospitals and health systems are subject to significant penalties under Medicare's Hospital Readmissions Reduction Program, adding a financial incentive for preventing unplanned returns to the inpatient setting. In addition to improving transitions of care and deploying care coordination strategies, predictive analytics can warn providers when a patient's risk factors indicate a high likelihood for readmission within the 30-day window. Getting ahead of patient deterioration. While still in the hospital, patients face a number of potential threats to their well-being, including the development of sepsis, the acquisition of a hard-to-treat infection, or a sudden downturn due to their existing clinical conditions. Data analytics can help providers react as quickly as possible to changes in a patient's vitals, and may be able to identify an upcoming deterioration before symptoms clearly manifest themselves to the naked eye. Forestalling appointment no-shows. Unexpected gaps in the daily calendar can have financial ramifications for the organization while throwing off a clinician's entire workflow. Using predictive analytics to identify patients likely to skip an appointment without advanced notice can improve provider satisfaction, cut down on revenue losses, and give organizations the opportunity to offer open slots to other patients, thereby increasing speedy access to care. Preventing suicide and patient self-harm. Early identification of individuals likely to cause harm to themselves can ensure that these patients receive the mental health care they need to avoid serious events, including suicide. Predicting patient utilization patterns. In addition to helping organizations get ahead of no-shows, predictive analytics can give providers a heads-up when the clinic is about to get busy. Using analytics to predict patterns in utilization can help to ensure optimal staffing levels, while reducing wait times and raising patient satisfaction. Managing the supply chain. The supply chain is one of a provider's largest cost centers, and represents one of the most significant opportunities for healthcare organizations to trim unnecessary spending and improve efficiency. Predictive tools are in high demand among hospital executives looking to reduce variation and gain more actionable insights into ordering patterns and supply utilization. Ensuring strong data security. Predictive analytics and artificial intelligence are also anticipated to play an important role in cybersecurity, especially as the sophistication of attacks continues to increase. Using analytics tools to monitor patterns in data access, sharing, and utilization can give organizations an early warning when something changes, especially when those changes indicate an intruder may have penetrated the network. Developing precision medicine and new therapies. As precision medicine and genomics gain steam, providers and researchers are turning to analytics to supplement traditional clinical trials and drug discovery techniques. In silico testing is a promising way to reduce the need to recruit patients for complex and costly clinical trials while speeding up the evaluation of new therapies. Bolstering patient engagement and satisfaction. In addition to supporting chronic disease management strategies, cutting wait times, and targeting therapies to produce better outcomes, predictive analytics can keep patients engaged in other aspects of their care as well. Consumer relationship management has become a vital skill for both providers and insurance companies looking to promote wellness and reduce long-term spending, and predicting patient behaviors is a key component of developing effective communications and adherence techniques. Using predictive analytics to inform care management decisions and develop stronger, more motivational relationships between patients and providers can improve long-term engagement and reduce the risks associated with chronic diseases. If you enjoyed this video, don't forget to like and subscribe.